Hey guys, I am Vivek Gaur, your cool physical therapist and educator. In today's video, we are going to discuss a case which was presented to the neurology ward when I was posted in the neurology section. This case of mine was presented to emergency first and then shifted to the ward, and we are going to make a neurological differential diagnosis on this case. So let's get started. So a 21-year-old male patient is admitted to emergency with history of one-sided weakness that developed overnight and difficulty speaking. On examination, the patient had flaccid limb on right side and he could not speak but understood the commands. There was no visual field abnormalities, incontinence, seizure disorder or headache that were reported by the patient or the family. The patient had no history of such symptom in past either, no medico-surgical records and no known drug allergies. Family history was positive for hyperlipidemia, hypertension and diabetes from paternal side, and hyperlipidemia and hypertension from maternal side. Patient was a recent casual smoker, a habit that he developed in college, which was less than 1 year old. No history of alcohol intake or drug abuse was reported by the patient. So we have to make a list of differential diagnosis and then come to a probable diagnosis that we have to determine depending on the presentation of this case. So let's start the process of differential diagnosis. One of the most important aspects of neurocondition is meticulous history taking. A hemiplegic presentation in young adult is an uncommon occurring. An acute unilateral paralysis in young patient can come primarily with three conditions. The first one being cerebrovascular accidents, CVA, which is also known as stroke. The second one is post-ictal paresis or Todd's paresis. It's also called post-ictal Todd's paresis in seizures disorder, मतलब seizure में. The third one is low sugar level, that means hypoglycemia. So these are the primarily three suspects in this case, but we will see as we go forward that there might be several other reasons which may cause a stroke in young adult. A detailed past history is vitally important. In this case, there was no preceding history of seizure disorder in past. We know that people who lose consciousness with generalized seizures, only 6% of them would report post-ictal paralysis, which sometimes lasts minutes, sometimes for hours, but it eventually subsides within 48 hours. It's important to note down that post-ictal Todd's paresis after seizure disorders resembles a stroke-like presentation with loss of consciousness, one side of paralysis, as well as confusion and speech problem. Talking about hypoglycemia, it is defined as blood glucose levels less than 70 mg per deciliter of blood. Hypoglycemia can cause confusion, behavioral changes, loss of confusion, as well as seizures. But sometimes diabetic patients do end up in emergency closely resembling stroke to an extent that it resembles hemiplegia and aphasia. This is called hypoglycemia induced hemiplegia, but it usually resolves immediately with administration of IV dextrose infusion. This particular case had no history of seizure disorder, diabetes, and early blood test reported his blood sugar level as normal, and therefore we have to consider cerebrovascular accident, meaning stroke in this case now. It's noteworthy that CVA stroke is considered an illness of elderly, and we know that 88% of all cases of CVA occur in population older than 45 years of age. However, 12% of all stroke cases are reported in population younger than 45 years of age. The World Stroke Organization reported almost 13 million new stroke cases in the year 2019. That means once in a while you are going to come across a person who is less than 45 years of age and has suffered consequences of the stroke. Now let's discuss the risk factor for stroke in young adults. There are few as compared to the stroke those happen in elderly, but there are several risk factors that we can categorize over here, like premature atherosclerosis, hematological disorder, particularly those inducing thrombophilia, cervical or carotid artery dissection, and of course the regular risk factors like young obese subjects, other than that smoking, alcohol and drug abuse, and of course a diet high in trans fats as well as lower level of physical activity. All these contribute to stroke in young adults. But since the traditional risk factor of stroke are largely not present in young adults, possibility of the embolism has to be explored early during the differential diagnosis process. Majority of the emboli are cardioembolic. That means they either originate in heart or pass through the heart. So a lot of young stroke cases are because of the cardioembolic stroke, which is the embolus being originated in heart. But unfortunately, almost 40% of all young stroke cases are undiagnosed, and they are called the cryptogenic stroke. That means we are not able to determine what was the exact reason of stroke in these patients. There is something called as paradoxical embolism via patent foramen ovale. Foramen ovale is an opening between right atrium and left atrium, and this is a physiologic need during the fetal circulation. In majority of people, the foramen ovale closes in first year of life, but in about 25% of population it remains open and is called a patent foramen ovale. Not all people having patent foramen ovale will have emboli and stroke, but sometimes an embolus that develops in veins can pass through the foramen ovale and therefore from the right side of heart to the left side and cause stroke. Therefore, it is advisable to look at heart and find the source of the embolus. Now let's discuss the type of stroke. Now speaking about the type of stroke, we know that stroke is roughly categorized into two categories: the ischemic stroke as well as the hemorrhagic stroke. Ischemic stroke is further categorized into two categories, one of being the thrombotic stroke and the other being the embolic stroke. Thrombotic stroke, they develop relatively gradually. So the presentation will be like patient had numbness or paralysis in one part of the limb, and then after a few hours the whole limb gets paralyzed or whole side gets paralyzed. So it has a gradual presentation relatively, whereas the embolic stroke is such in nature that it develops like bam and full stroke intensity is developed. Whole side is paralyzed at one instance, and both these stroke relatively they happen mostly during the nights as compared to the hemorrhagic stroke, which happen mostly during day during the activity. So after detailed history taking in a ward setting, you move on to do a detailed neurological examination, which includes cranial nerve examination, detailed sensory motor testing, reflexes, Babinski sign, etc. This patient had speech problem where he couldn't speak but understood the command. A detailed speech examination is therefore vitally important in this case to make a precise diagnosis, and therefore I'll be making separate video on detailed speech function assessment later. In acute stroke, the limb might appear completely flaccid and it may take few days before tone develops. A hemiplegic pattern of increased flexor tone in upper limb and increased extensor tone in lower limb may not appear immediately and might take few days or even weeks to develop. Now let's discuss other causes which mimic acute stroke-like symptom in a young adult. So there is something called acute vestibular syndrome, like the vestibular neuronitis as well as Meniere's disease, which might present with acute dizziness and confusion. Migraine, particularly the acephalgic kind where the headache is not so prominent, but focal neurological disorders, for example, numbness in an arm or leg might be prominent. It may mimic stroke-like presentation as well. Then there are infections, brain tumor, metabolic encephalopathy other than hypoglycemia, hypertensive encephalopathy, and convergent disorder. These all might mimic a stroke-like presentation. Less frequently, even cardiac events, herpes simplex encephalitis, demyelinating diseases like multiple sclerosis, as well as myasthenia might also mimic a stroke-like presentation in acute setting. Guys, since stroke in young adult is uncommon, it has more chances of going misdiagnosed too. The diagnosis is more straightforward with typical presentation like hemiparesis and aphasia, just like it was in our case. But with atypical symptoms, it is challenging to diagnose a young stroke case. It's particularly challenging when the right hemisphere is involved because the language is preserved. Also, a confusional state without marked paralysis in a very acute setting. Also, other than that, if there is diminished level of alertness, it might go undiagnosed. So stroke mostly causes negative symptoms like loss of a function, for example, loss of function of upper limb as well as lower limb, like weakness, or aphasia, like loss of speech. But positive symptoms should not be ignored. For example, a unilateral limb shaking, hemibalisbus, as well as chorea, all of these should not be dismissed. So our case today was a cryptogenic stroke with Broca's aphasia resulting in right-sided hemiplegia and motor aphasia. In next video, we will summarize the investigation and early medical management of such cases. Meanwhile, you go ahead and share your list of differential diagnosis if you have made any clinical reasoning on this case that you might think is more relevant, and also your experience of CVA in young adults. Guys, if you like today's video, please like and share with your friends or study group, and consider joining the student membership on my channel. I will see you soon in the next video. Meanwhile, keep moving, keep fit, stay healthy, stay sharp. I am Vivek Gaur, your cool physical therapist. Bye-bye.